This lecture is about empowering the woman, and it's based on extensive literature and 3 published articles by myself. We have done a lot of research, which was recently summarized in a book called Checkmate by Protein Invisible Enemy, and which sells now on Amazon. Other publications include wound healing, neuropathic pain, how women have hidden issues, female sexuality, the importance of systemic balance, visceral fat issues. There's a number of publications, about 21 of them. You can go to scholar.google.com and just type my name. What is the basic hormonal issue? Estrogen declines in women with age. Bleeding and burning sensations during intercourse lead to low self-confidence and interpersonal conflict or neglect. There is vaginal atrophy, pathophysiology, cellular changes. In the pursuit of happiness, women attempt to resolve the psychodynamic roller coaster of aging by merely altering their vaginal physique. Laser RF vaginal rejuvenation studies claim female satisfaction. However, either they do not use questionnaires that are valid, or they do use self-report questionnaires that can be prone to lying. And this is some of the studies here that you can see. Our RF research reports success, but without achieving statistical significance. So when you look at the data, only 92% was satisfied, and 9 out of 25 subjects reported increased satisfaction regarding their orgasms. That's below chance, that's 36%. 16 out of 25 subjects, or 64%, reported no change. Another laser study, and one of many, use valid testing instruments like the FSFI. I'm just giving you examples. Obviously, I went through many laser studies. They claim high statistical significance, but in fact, the data reveals no statistical significance. So they report 0.001. However, only 85%, that's 0.15, gained normal sexual life. And 26% of the women were not even sexually active. So these women could not possibly evaluate themselves, since they did not have anything to evaluate. They were not sexually active to be able to evaluate their sexual life. There is several review articles that criticize laser RF vaginal rejuvenation studies because they focus merely on vaginal physique and they ignore age-related hormonal changes, depression, anxiety, quality of life, effects of 200 known hormones, psychological dynamic states, the complexity of sexual desire, which involves health status, CNS, neurotransmitters, cognition, and attitudes. There are side effects with laser NRF vaginal rejuvenation. A number of federal agencies, including the FDA, have recently issued warnings against surgical laser NRF vaginal rejuvenation cosmetic procedures. Between October 2015 and January 2019, there were about 46 patients with primarily pain after vaginal rejuvenation. But a lot of these patients sought medical care for their injuries, which included evaluation by urgent care, urology, gynecology, neurology, gastroenterology, pelvic floor therapy. And 33 of these patients indicated chronicity of their injuries, which included long-term pain, numbness, burning, bladder disturbances, infections, scarring, dyspareunia, and in some cases, disfigurement. Most laser RF studies, well, all of them that I looked at, I probably haven't looked at all of them, but all of them that I looked at, they lack both internal and external validity. Threats to internal validity is primarily instrumentation. So laser RF studies either use their own self-made instruments with no proven validity or reliability, or they use the FSFI or the FSDS and the revised version. These are short, straightforward, transparent, and therefore prone to denial, and also prone to poor self-awareness or lying. Why would women lie? They do, and they lie better than men. Some women may lie because they're primarily concerned with satisfying their partners rather than themselves. Others may conceal the truth due to fear of disapproval, or because they blame themselves for their physical vaginal problems persisting despite the expensive vaginal rejuvenation procedure. So what we did is we administered MMPI to 14 women who had undergone laser and RF rejuvenation and had very high FSFI scores. As you can see here, their scores were very high in the FSFI. So they all claimed great satisfaction after the vaginal rejuvenation procedure. So what we did is we plotted the FSFI scores against the MMPI-2 lie scale, depression scale, and hysteria scale. And what we found, according to the statistical analysis, was that FSFI and the lie scale were highly correlated at 0.01. What this denotes is that these women were untruthful. Either they were in denial or they were just lying. Their scores on the FSFI also correlated very highly with both the hysteria and the depression scale. So what we saw is that on the outside, there was a need for attention and acceptance, always vibrant and pleasant. And on the inside, there was screaming and there was depression. When it comes to women, nothing is as it seems. We also administered the differential emotion scales. And the results on the DS revealed that 98% of these women were organized around the emotions of shame, sadness, and joy. Such results indicated a multi-layered emotional organization that possibly reflect joy on the outside and shame and sadness on the inside. But let's start from the most basic question. Will changing a woman's physique, vaginal physique, guarantee her happiness? Will vaginal rejuvenation improve quality of life? What makes women insecure? Hormonal imbalance is one of the biggest ones, because when they're imbalanced, they're stepping on shaky ground. It's not about replenishing one hormone. It's about a harmonious interaction of hormones working together. Cortisol rising towards the peak of the normal range may create stress and stress-eating behaviors. That means weight gain. 3 at the lower end also will increase weight gain. So a preventive perspective focuses on the rate of differentiation, observing the degrees of minor imbalances within normalcy before they are exacerbated into a medical disorder. A drop of estrogen does contribute to belly fat and obesity, which women would like to hide. Another problem is that metabolism slows down. So basically you have a decreased basal metabolic rate, BMR. So when you're lying, or when you're sleeping, or when you're sitting, you burn less calories than what you were burning when you were younger. So in the pursuit of happiness, vaginal rejuvenation alone cannot secure female happiness or empowerment. Female empowerment comes from self-confidence, inner balance that requires hormonal balance, control, weight and hunger, increase metabolism, increase fitness, and reinforce self-assertion without the fear of judgments for both medical and psychological components. A published study using the London University virtual exercising technology found that BMR increased by 97.44. And there was also significant weight loss as well. This same technology was utilized to assess visceral fat, and they found that the percentage of visceral fat decrease was 30.34%, 3 increased by 30%. All of these results are highly significant. All the subjects gained the benefit. 11 of the subjects did sonograms before and after. They had fatty liver before 12 treatments and no evidence of fatty liver afterwards. And this is what fatty liver, it invades the liver, and visceral fat invades all the organs and compromises their function, and it cannot be removed by lasers or RF. Toxicity in visceral adiposity increases hunger. Actually, all toxicity increases hunger. The more toxic you are, the more hungry you are. Toxicity promotes insulin and leptin resistance. Leptin is an anorexic hormone. It stops you from being hungry. So its resistance means that you have leptin there, but the leptin does not signal. So it's useless. So hunger increases. It also elevates ghrelin. And ghrelin is what increases appetite. So therefore, hunger increases. So leptin and ghrelin imbalance will increase hunger. Hunger will increase food consumption, weight gain, visceral fat increase. That will increase toxicity, which will increase hunger. And it's going to be a vicious circle. This London University Effortless exercise technology we looked at, and there was documented increases of leptin and decreases in ghrelin after 12 sessions. So it suppresses hunger. Laser studies combined with the exercises noted a decrease in leptin. That's the anorexic hormone. So basically that's increase of hunger. And regular exercise, prolonged exercise, decreases leptin concentrations by 32%, and again, increases hunger. Obviously it does, because you expand the energy, so you need the energy back. So in our studies, we found an increase of leptin at 32.23%, at decrease of ghrelin minus 14.57%. VDL and triglycerides decreased, highly significant. Free T3 increased, leptin increased, ghrelin and cortisol decreased, testosterone increased, visceral adipose tissue decreased, skeletal muscle mass and IGF-1 increased. All that were very highly significant from a number of studies. Conclusion: females are often in charge of keeping the family together. Therefore, success of interpersonal relationships depends on female satisfaction and female improved quality of life. In assessing female satisfaction after vaginal rejuvenation or any procedure, short questionnaires like the FSFI may be insufficient in assessing the richness of female dynamics. Therefore, the conclusions drawn on female satisfaction from these questionnaires may in fact be false or invalid. Female confidence comes from within and depends on multiple factors. Vaginal rejuvenation is just one of many. By itself, it cannot empower the woman or offer her happiness. Always consider hormonal balance, fitness and health, sculpted body, energy level, mood, sense of independence, and self of contentment and wellness. This is our medical board that is conducting the research and provides the data for our research department. And with this, I would like to conclude my lecture, and thank you very much for inviting me. If you do have any questions, please feel free to email me at science@aelios.com. Thank you very much. This lecture is about empowering the woman, and it's based on extensive literature and 3 published articles by myself. We have done a lot of research summarized in a book called Checkmate by Protein Invisible Enemy. What is the basic hormonal issue? There is estrogen decline in women. There is bleeding and burning sensations during intercourse that lead to low self-confidence, which lead to interpersonal conflict and neglect. There's vaginal atrophy, pathophysiology, cellular changes. In the pursuit of happiness, women attempt to resolve the psychodynamic roller coaster of aging by merely altering their vagina physique. Laser and RF rejuvenation studies claim female satisfaction. However, a lot of these are based on self-report questionnaires that are validated, and a lot of them are based on questionnaires that the researchers made up that were never validated and do not have internal or external validity. RF research reports success, but without achieving statistical significance. For example, 23 out of 25 subjects, that's 92%. It's not significant. And if you look at the data, only 9 out of 25 subjects reported increased satisfaction in this Alice et al. Study in 2017. That's only 36%, which is below chance. 16 out of 25 subjects, or 64%, reported central nervous system, neurotransmitters, cognition, and attitudes. Side effects with laser and RF rejuvenation studies have led a number of federal agencies, including the FDA, that have recently issued warnings against surgical laser and RF vaginal rejuvenation cosmetic interventions. Between October 2015 and January 2019, there were about 45 severe cases. 46 patients were recorded and reviewed. The most commonly reported adverse event related to the procedure was pain. The majority of patients sought medical care for their injuries, which included evaluation by urgent care, urology, gynecology, neurology, gastroenterology, pelvic floor therapy, primary care providers, and so on and so forth. 33 patients indicated chronicity of their injuries, which included long-term pain, numbness, burning, bladder disturbances, infections, scarring, and dyspareunia, and in several cases, disfigurement. Most laser and RF studies, at least all of them that I looked at, and I looked in several of them, they do not have external or internal validity, and they report fantastic results, but the data does not support it. The main threat to internal validity is instrumentation. A lot of laser and RF studies, they just make up their own instruments, which obviously they're not valid or reliable. And others use the FSFI or the FSDS, and the revised version recently. But these instruments are short, straightforward, transparent, and therefore they're prone to denial, poor self-awareness, or lying. Why would women lie? Some women may lie because they're primarily concerned with satisfying their partners rather than themselves. Women may conceal the truth due to the fear of disapproval, or because they blame themselves for their physical vaginal problems persisting despite the expensive vaginal rejuvenation intervention. So what we did, we administered the MMPI, which is an extremely valid instrument. And we correlated the FSFI with the MMPI. And as you can see, the FSFI scores were extremely high. They were very, very high. And these scores were plotted against the MMPI-2 subscales of lying, depression, and hysteria. What we found, statistical analysis showed a very high correlation of SFFI and the lie scale of the MMPI at probability level 0.01. So just, God damn it, honey, fuck, man, Myla, can you get honey? I have to redo it now from the beginning. God damn it! Jesus Christ! Jesus Christ.